Maria Teresa, and thank you to all of you for joining us today and braving this horrible weather. I would like to introduce another speaker for our greeting this morning. It's Françoise Grosstête. She is a French politician and member of the European Parliament for the southeast of France. Grosstête was first elected as an MEP in the 1994 European elections. She has since been serving on various committees, including this committee on the environment, public health, and food safety. In 2010, she led the Parliament's negotiations on the directive on patients' rights in cross-border healthcare. A few years ago, in 2014, Françoise Grosstête proposed to establish a European Parliament intergroup on health for citizens, including stakeholders such as the European Cancer Patients Association and the Organization for European Cancer Institutes. She's also a member of the MEP Heart Group, a group of parliamentarians who have an interest in promoting measures that will help reduce the burden of cardiovascular diseases. Françoise, she couldn't be with us today, but she so kindly sent us a video message, which we would like to share with you now.
Ladies and gentlemen, as President of the European Alzheimer Alliance, I have always tirelessly worked to make neurodegenerative diseases a priority of the EU health policy agenda. As such, I am very well aware that many brain diseases disproportionately affect women, both as patients and carers. Alzheimer is unfortunately a case in point, with 2/3 of patients worldwide being women. As you very well know, those women are therefore at a higher risk of social isolation, poorer health condition, and difficult financial situation. Yet, women are underrepresented at many levels of the therapeutic development process and lack specific social support. This is the reason why the Women Brain Project was founded. And this is the reason why I am particularly honored to be given the opportunity to voice out my support for this cause today. As a woman and a policymaker, I wanted to let you know that you can count on my full support in the European Parliament to raise awareness and advocate for women's brain and mental health. I think indeed that we need to fill the gap at European level. We must be able to better address the fate and specificities of women and dementia. While health mainly remains a national competence, the EU can play an important role in helping to share knowledge, to promote early diagnosis, improve prevention, and increase medical research funding. Research is particularly important in my eyes, as we need to better understand why women's brain is more prone to certain diseases. Therapeutic innovation should follow in parallel. Therefore, the EU research agenda must be shaped to address sex differences in dementia. We already have powerful tools at our disposal to do so. The EU flagship program for research and innovation, Horizon 2020, with a 77 billion euros budget over 7 years, and the Innovative Medicines Initiative, the world's biggest public-private partnership in the field of life sciences. I will do everything I can to ensure that those programs embrace the topic of gender specificity in dementia. Beyond that, I will continue to raise awareness to include a gender-sensitive perspective in all policies, consistent with the EU 2020 strategy, the 2030 Agenda for Sustainable Development Goals, and WHO Action on Dementia. This is only the beginning. The path ahead is steep, but I am sure that with enough determination, we can manage to steer a global discussion on sex determinants of female vulnerability to brain diseases in the best interest of patients and carers. Once again, I want to assure you of my total support. Thank you for your attention.